If you have a stiff or locked up SI joint, try this. In many cases of SI joint pain, I see a lot of people with tightness and compression of muscles, particularly on the backside of the pelvis. These muscles are typically external rotators of the pelvis and the hip. So typically when tight, they pull the pelvis into this sort of a shape right here, which I'm very much exaggerating for the purposes of visual demonstration. From a front perspective, it looks like this right here. When the pelvis is stuck in this shape, I see a lot of people who can't genuinely rotate and move their pelvis very well. It's kind of just stuck and jammed into this position. So the SI joint gets a lot of compression as a net result of that because everything through here is tight, locking up the ability for this space to have some freedom of movement. A really effective initial solution I find is to help get the pelvis into more of an internally rotated shape like this. You can see how this will create a little bit of gapping or opening of the SI joint, which can be nice for decompression and relief. All you're really going to need for this is a foam roller and a small hand towel rolled up about this thick, a little bit more or less depending on you as an individual and what's comfortable. So first you want to find the side top crest of your pelvis bone, which is right exactly here, because we want to lay directly on the apex of that towel roll. So that way it's just gently resting on that bone right there. What that's going to do is help push it into that internally rotated shape. Start laying on the side with a locked up SI joint with both your hips and knees bent at a 90-degree angle. For some people, they can go a little bit less than that 90-degree angle if it's more comfortable, but find what works for you. Now, for some people, just laying in this position can provide a lot of relief, and all they need to do is just breathe in a relaxed state. But if you want to add a little bit more dynamic movement and decompression of the SI joint, you can take a foam roller and put it in between your mid-thighs, keeping your feet stacked on top of each other. Now, all you're going to do is a very subtle movement, but you always want to make sure that you have some contact of that top pelvic crest on the side that is on that towel roll. Now, all you're going to do is very gently push that top knee very gently and very slightly ahead of the bottom knee, just an inch or two. It doesn't need to be more than that. You're going to feel yourself roll onto more of that forward portion of that pelvic crest. And then you're going to inhale through your nose and very gently roll that top knee behind the bottom knee. Just again, a couple of inches, not much. And now you're going to be placing more of that pressure of your body weight through the back half of that pelvic crest. Not only is this going to passively decompress your SI joint, it's also going to give you the added benefit of starting to loosen up some movement within your femurs and their ability to glide within the hip sockets. One thing you always want to make sure of is that you're keeping the bottom side knee flat on the ground. If you're rolling back and that knee lifts up, that means that you are now moving through your spine and not as much through your hips as we want. It's so slow, it's so methodical, and it's so relaxed. Those are always the keys. Try about 2 sets of 10 slow rolls forward and back and see how you feel after.